On the occasion of World Mental Health Day, the Department of Health and Family Welfare today announced the draft Meghalaya Mental Health and Social Care Policy. Health Minister James Sangma made the announcement at the main secretariat in Shillong. Addressing press persons, the Health Minister said that Meghalaya is the first state in the northeast and among the few in the nation to have come up with the mental health policy. The Health Minister also said that the draft policy has been posted online in the Health Department's official website and NHM Meghalaya's website and would be there for the next 15 days for suggestions and feedback from the public.
I would like to take this opportunity on as we celebrate the World Mental Health Day today, the 10th of October, and I take immense pleasure and honor in announcing that the government of Meghalaya, the health department, has completed the exercise of preparing a draft mental health policy, which we are announcing today and which will be put up in the public domain, namely in the website of the Department of Health and Family Welfare and of the Meghalaya NHM. The name of this mental health policy is the Meghalaya Mental Health and Social Care Policy. This policy has been in the making for quite some time. This committee, which was formed to look into drafting this policy, was formed some time back under the chairmanship of our principal secretary, who was tasked to come up with the policy. And accordingly, there have been number of meetings which have taken place towards the drafting of this policy. Another subcommittee was also formed to go into finer details of the policy, which was formed some time back, and this subcommittee was headed by Dr. Vandana Gopikumar, who also is one of the members of the National Mental Health Policy Drafting Committee and also one of the members of the Tamil Nadu State Mental Health Policy. So she, along with other team members of the subcommittee, including Samvad, who have been instrumental in providing a lot of work in terms of adolescent and child mental health. We've been able to today, because of the work put in by the subcommittees and by the committee, come up with a mental health policy which is very, very holistic in nature. And I would like to take this opportunity to just go through some of the salient features of this policy that we are bringing out today in the website, which will be made available to the public for seeking or soliciting their views and their comments, which will be, if there is merit found to it, incorporated into the mental health policy and will be then taken up to the cabinet for its approval. So some of the salient features of this mental health policy is that there is a focus on public mental health to promote a holistic well-being approach. This involves the creating awareness, through the existing 460 sub-centers and more than 6,500 plus village health councils, with a focus on promotion of mental health. It entails supporting residents through problem solving, especially in the context of vulnerable groups, working on collaborative care designs, cultural congruence, building a sense of community ownership to tackle the issue of mental health. The emphasis will also be laid on building safe spaces and a first responders team who would offer psychological first aid. Here our focus will be to prevent and address distress and loneliness. Other salient features of this is early identification and care pathways. As part of an integral public mental health approach, ensuring early identification and care pathways through mental health triage scales to address concerns based on need urgency while building effective follow-up systems. This would involve putting systems in place like making services accessible to people's homes through integration of PHCs and CHCs with emergency care and recovery centers. The care teams would be linked to specialists through telepsychotherapists whenever needed, and bed capacity would also be enhanced. Availability of medication would also be ensured for all. The idea is also to challenge the stigma surrounding mental health among people. Other salient features is an integrated care system and workforce, which involves bringing together diverse groups to adopt healing rituals and indigenous medicine alongside contemporary mental health methods, ensuring continuity of care through a larger workforce that is culturally sensitive and responsive to and enabling availability of local and trained workforce. Also, an increase in number of indigenous workforce will help service communities better and ensure continuity of care. We are also looking at the use of sub-centers and our village health councils as platforms for information dissemination and sensitization. We are also looking at focus on multi-sectoral participation from diverse stakeholders and peer advocates. This we feel will help in building trust and focus on personal recovery and valued social roles. There's also this focus on reporting and providing access to the vulnerable groups. And also focus on research and evidence-based practices for impactful plans and policies and inclusive long-term care options. So this is the draft policy which is being made available on the website of the Meghalaya Health Department, and this will be made available for the next 15 days, seeking the views and comments of the public. I would like to take this opportunity to urge the people of our state to go through this draft policy and to give us their suggestions, their views, then their comments, whether they are in agreement or whether they are in disagreement, whatever the case may be. We seek the views and comments of the public because they are the biggest stakeholders in this whole exercise. And I hope that people will go through this draft mental and social care policy to come up with good suggestions which we will be able to incorporate into our policy. And I'm proud of the fact that Meghalaya is the first state from the northeast to have come up with the state mental health policy, and we are one of the few. I think Tamil Nadu and Kerala are the other two states having a mental health policy. So we are probably the third state in the country to have our own mental health policy, which will be coming up and will fructify as soon as the cabinet gives its nod to it.
Meanwhile, Principal Secretary, Health and Family Welfare, Sampat Kumar acknowledged the shortage of mental health professionals in the state, however added that the government is aiming at training more in-service doctors to address the issue.
As one of the findings is that we need to, train more professionals. That's one of the, the policy is essentially that like what are the issues where we need to focus upon. So now we will work on that. Correct. So now we need to get train more in-service doctors on psychiatry. Recently, I think our honorable minister, we all went to Tamil Nadu to sign an MOU with the Tamil Nadu government where they can help us in training our in-service doctors, because we don't have that kind of a training facilities in Northeast. So we are actually taking that help too. We have one facility in Tejpur. There also we trained some of the doctors, but we are going to send more and more people.